There is a warning on the metformin label, not hidden, not removed, right there in the prescribing information in the section called Warnings and Precautions, section 5.6. It says, metformin may lower vitamin B12 levels. Monitor hematologic parameters annually. That warning has been there since the earliest clinical trials showed that in just 29 weeks on the medication, approximately 7% of patients developed subnormal B12 levels. 7%, in less than 8 months. In 2022, the UK's Medicines and Healthcare Products Regulatory Agency went further. After a formal review of the evidence, they upgraded B12 deficiency to a common side effect of metformin. Not rare, not occasional. Common, affecting up to 1 in 10 people on the medication. And they updated the prescribing information for all metformin-containing medications to reflect it. The FDA followed with updated monitoring recommendations, B12 testing at baseline, and every 1 to 2 years in patients on long-term therapy. The warning was there. The guidance was upgraded. The monitoring was recommended. And the tingling in your feet is still there. Because nobody told you. I am Dr. Mary, and today I am going to show you exactly what metformin does to the vitamin your leg nerves depend on, and why the symptom it causes is the one most consistently mistaken for something else entirely. Metformin is a remarkable medication. For people with type 2 diabetes or prediabetes, it is often the first medication prescribed, and for good reason. It lowers blood sugar effectively, it is well tolerated by most people, it has decades of safety data behind it, and it may carry cardiovascular benefits beyond glucose control. For many people, it is doing exactly what it should. What the conversation at the point of prescribing almost never includes is this: the longer you take metformin, and the higher the dose, the greater the likelihood that your B12 levels will fall. The risk grows every year from the moment you begin the medication. After 4 years, the ADA recommends B12 monitoring. After 5 years, the depletion of hepatic B12 reserves, the reserves your liver has been using to buffer the decline, begins to show up in how your nerves function. And the symptom it produces is one that has been sending millions of seniors in the wrong direction for decades. Stay with me. Because what I am going to tell you about the connection between metformin, B12, and your legs may reframe something your doctor has been calling by a different name. I want to tell you about a woman I will call Grace. Grace was 71. She had been on metformin for 8 years. Prescribed when she was diagnosed with type 2 diabetes in her early 60s. Her blood sugar was well managed, her A1C was consistently in a good range, her endocrinologist was satisfied. But for the last 3 years, Grace's feet had not felt right. It started as a faint tingling in her toes, so subtle she assumed it was the way she had been sitting. Then it spread. Both feet, the soles most consistently, a burning quality at night that made it difficult to fall asleep. Some mornings, the sensation in her feet felt distant, muffled, like she was walking on foam. She told her endocrinologist. He ordered nerve conduction studies. The results showed mild peripheral neuropathy. He told her this was a common complication of diabetes, that her blood sugar control was good, and that the neuropathy was likely the result of cumulative nerve damage from years of elevated glucose. He was not wrong that diabetic neuropathy is common. He was not wrong that glucose damages nerves. What he did not ask was whether Grace's B12 had ever been tested. It had not. In 8 years on metformin, her B12 had never been measured. And when it finally was when Grace asked specifically, after watching a video much like this one, her level came back at 189 picograms per milliliter. The lower limit of the standard laboratory range is 200. She was below it. Her neuropathy was real. But it was not only from diabetes. And the thing that was adding to it, possibly causing most of it, had been building for 8 years in plain sight, with a monitoring recommendation on the label that nobody had followed. Here is what metformin does to B12 and why it matters so specifically for your legs and feet. Vitamin B12 reaches your bloodstream through a precise multi-step process. You eat B12 in animal proteins, meat, eggs, dairy. Your stomach secretes a protein called intrinsic factor. In your small intestine, B12 binds to intrinsic factor, forming a complex. That complex travels to the end of your small intestine, the terminal ileum, where it docks onto specialized receptors on the intestinal wall and is absorbed into your blood. That docking process, where the B12 intrinsic factor complex attaches to the receptor, is calcium dependent. It requires calcium to complete the handoff. Metformin interferes with calcium-dependent membrane functions in the terminal ileum. It disrupts the calcium-mediated step that allows the receptor to accept the B12 complex from the intestinal wall. The B12 is there. The intrinsic factor is there. The receptor is there. But the receptor cannot reach out to take it. Think of it this way. Imagine a relay race. The first runner arrives at the exchange zone, arm extended, baton ready. The second runner is waiting, but something is blocking the second runner's ability to reach out and grab it. The handoff mechanism is blocked. The baton stays with the first runner, and the race, the delivery of B12 into your blood, never completes. Your body has reserves. Your liver stores B12 enough to last several years under normal depletion. This is why the deficiency is slow. This is why it takes 4, 5, 6 years on metformin before symptoms often appear. The reserves are substantial, and they buffer the decline for a long time. But they are not infinite, and when they finally fall low enough, what suffers first is the system that needs B12 most continuously, your peripheral nervous system. B12 is a structural component of myelin, the insulating sheath that wraps around your nerve fibers. Think of myelin as the plastic coating on an electrical wire. It keeps the signal traveling cleanly, at speed, in the right direction. When B12 falls, myelin degrades. Nerve signals that used to travel cleanly start to misfire, leak, or slow. In your legs and feet, that degradation shows up as tingling, burning, numbness, a sensation of walking on foam or sand, electric sensations at night, symptoms that feel unlike ordinary muscle cramps because they are not muscle symptoms at all. They are nerve symptoms, and the nerve that produces them is not damaged by your blood sugar. It is damaged by the absence of the vitamin your medication has been slowly blocking for years. Stay with me here, because what I am about to tell you about how this gets misdiagnosed is the piece that matters most for your actual care. When a person with type 2 diabetes reports tingling and numbness in their feet, the clinical default is diabetic peripheral neuropathy, and that diagnosis is often correct. High blood sugar does damage peripheral nerves over time through mechanisms involving oxidative stress and microvascular injury. But here's the problem. Metformin-induced B12 deficiency neuropathy and diabetic peripheral neuropathy produce symptoms that are clinically indistinguishable. The same tingling, the same burning, the same symmetrical distribution starting in the feet and moving upward. Even nerve conduction studies cannot reliably separate the two. A 2025 All of Us research program study, one of the largest real-world data analyses of metformin and neuropathy ever conducted, found that the risk of B12 deficiency increases 3% per year after starting metformin, and that the risk of peripheral neuropathy is greater with long-term metformin use, independent of diabetes duration. Meaning, the medication itself appears to contribute to neuropathy risk, separately from the diabetes it is treating. The clinical implication of that finding is significant. If you are on metformin and you have symptoms of peripheral neuropathy, tingling, burning, numbness in your feet, and lower legs the standard response of attributing it entirely to your diabetes and recommending better blood sugar control may be missing a correctable cause that is sitting in your medicine cabinet every morning. This is what happened to Grace. Her neuropathy was real, but part of its cause was reversible, and nobody tested for it for 8 years. Now let me tell you what finally changed for her and what the right response actually looks like. Here's what to do with this. Do not stop your metformin. For most people with type 2 diabetes, it is managing a genuinely important metabolic problem, and the decision to change it belongs to your doctor. What I want to give you is the language to initiate a specific and overdue conversation. Ask your doctor for a B12 test. Ask specifically, by name. And when you get the result, ask for the number, not just whether it is within range. Here is why that matters. The standard laboratory range for B12 typically starts at 200 picograms per milliliter. But research consistently shows that neurological symptoms, including the tingling and burning in your feet, can begin when B12 falls below 300. You can be told your B12 is normal and still be in a range where your nerve function is being affected. Knowing your number, not just your status, is the difference between catching this and missing it. Also, ask your doctor whether you have been tested at the right frequency. The updated FDA label recommends B12 monitoring every 1 to 2 years in patients on long-term metformin therapy. The ADA has recommended periodic testing for patients on metformin for more than 4 years since at least 2017. If you have been on metformin for more than 4 years and have never had a B12 test, that is a gap worth naming directly. On the question of supplementation, if your B12 is low or borderline, the form matters. Methylcobalamin is the form of B12 your nervous system uses most directly. It is generally preferred over cyanocobalamin for people with nerve symptoms, because it does not require conversion steps that may be impaired in people with absorption difficulties. Research supports oral doses of 1,000 micrograms daily for people with documented deficiency or borderline levels on metformin. And here's the one thing I saved for the end, because it addresses the root of what metformin does, not just the symptom it produces. Calcium. Research has shown that the metformin-induced impairment of B12 absorption at the terminal ileum, the calcium-dependent blockade of the receptor, can be at least partially counteracted by calcium supplementation. A study published in Diabetes Care demonstrated that increased calcium intake reverses B12 malabsorption induced by metformin, not calcium alone as a substitute for monitoring or supplementation, but as a meaningful addition to a comprehensive approach to protecting your nerve health while continuing the medication. Grace supplemented with methylcobalamin at 1,000 micrograms daily with her doctor's agreement. She also added a calcium supplement. Over 6 months, her B12 rose back into a healthy range. The burning at night reduced significantly. The foam walking sensation in her feet improved. Her neuropathy did not fully resolve some of the nerve change from years of diabetes, was structural, but a measurable portion of what she had been living with for 3 years was correctable, and it was corrected. Tomorrow morning, before you take your metformin, put one note in your phone: when was my last B12 test? If you cannot answer that question, the answer is overdue. That note, brought to your next appointment, may be the most important 3 seconds you spend this week. 3 things to carry with you. 1. Metformin blocks the calcium-dependent step that allows the B12 intrinsic factor complex to be absorbed in the terminal ileum. The FDA label has carried a B12 monitoring warning since the earliest clinical trials. In 2022, regulators upgraded B12 deficiency to a common side effect. Most long-term metformin users have never been told, and many have never been tested. 2. Metformin-induced B12 deficiency neuropathy and diabetic peripheral neuropathy are clinically indistinguishable on symptoms alone. If you have tingling or burning in your feet and you are on metformin, B12 is not a footnote to the investigation. It is a primary suspect. And it is one that responds to treatment. 3. Knowing your B12 number matters more than knowing your B12 status. Normal on a lab report can mean 201, 1 point above the floor. Neurological symptoms can begin below 300. Ask for the number. Ask what your monitoring schedule has been. And ask specifically about methylcobalamin if supplementation is indicated. Before I go, I want to leave you with something that has been building across this entire series. We have now covered 6 medications. And in each case, the story has been the same. A medication doing its intended job, a secondary effect on the legs or nerves that was documented but never discussed, and a patient living with symptoms that had a name and a cause that nobody offered them. Statins and CoQ10, amlodipine and the prescribing cascade, beta blockers and the vascular balance, PPIs and magnesium, and now metformin and B12. Each one a separate depletion, each one a separate mechanism, each one affecting a different part of how your legs and nerves function. But here is the question I have been holding back for this moment. What happens to a person who is on 3 of these medications at the same time? Or 4? What happens when the CoQ10 is low and the magnesium is low and the B12 is low simultaneously in the same body on the same night? The damage does not add up. It multiplies. And the rate at which it multiplies depends on one specific compound that almost nobody is measuring, one that sits at the intersection of every pathway we have discussed, that every one of these systems depends on, and that is almost never tested even when all the symptoms are present. In next week's video, I am going to name it, show you exactly where it sits in all of these pathways, and tell you what happens and what becomes possible when you address it directly. Subscribe so you do not miss it, because if this series has felt like it is building towards something, it is. And next week is where everything we have covered comes together. I will see you then. Take care of those legs.